introduce him. Dr. Rohit Shetty. He's going to be our first speaker. And I deem it an honor to introduce a very dynamic ophthalmologist, come clinical and translational scientist, a vice chairman of Narayan Netralia Group of Hospitals, an FRCS himself, and an FRCS examiner who had a vision before any of us could contemplate. And this vision of his led him through various path-breaking discoveries related to PRK and its markers to a major breakthrough in understanding keratoconus as a disease entity. He's a high-volume refractive surgeon with skill sets ever evolving over 14 years. And besides the innumerable awards and orations, with the most prestigious Colonel Rangachari Award, AO Achievement Award, and the Cassibius Award for his outstanding contributions to refractive surgery by ISRS. We welcome you, Dr. Rohit, to talk on diagnosing ectasia, pearls, and pointers. On to you. Dr. Rohit?
Yeah. Now, is it clear now?
Yeah.
Thank you, ma'am. Thank you for the wonderful introduction. Also, ARC, the entire ARC team, and the President AIOS, Secretary AIOS for giving me this opportunity of diagnosing ectasia, pearls, and pointers. These are my financial interests. This is not going to come in way of what I'm going to present today. The high risk for progression of keratoconus, if you look at the papers we published, it looks at the age, the eye rubbing, and the atopic eye disease, change of glasses, and these factors which come into your way of, the hormonal and the genetic diseases, which could take you to a different level. So if you look at my presentation today, I will talk about topography. It's not possible to cover the entire gamut of topographies in 8 minutes, but I'll stick to what is very important from topography point of view, the epithelium, biomechanics, and the future, which is just a few minutes. From the topography, you really look at topographies today. There are various indices, and every indices, you can spend 1 hour just talking about one indices here. You're looking at you started all with the posterior elevation, then you have multiple things. I'm using Pentacam because it is something which is commonly used today, and most of the Scheimpflug based cameras follow the original thought process of the Pentacam. What is interesting now for people using is that machines have started becoming smarter. It tells you the staging also. This is something which is new. I'm just trying to pick up some new indices here. For example, one of the things is about the Erc grading, which is inbuilt into the system, and people using the Pentacam, it is freely available. The radius of curvature anterior, the posterior thinness Pachy, and this is something which you have to feed. All these three things comes from the machine itself. And based on that, it gives you a grading, and like A2, B2, C0, D1, which is based on the grading of what, based on the level of the normative database it has built in. This helps to look at the progression, severity of cross-linking, and also study the status. And if you're interested in this, this is a paper which is measured on the cone. This whole thing is measured on the cone, and you can see that these are all how the machine actually builds its classification. If you don't really want to really understand this, it is there. Otherwise, the machine automatically gives this these values, and this is the only thing which you have to add. Otherwise, everything is free-filled. How does it help in my practice? For example, if I'm looking at this as a progression, you can see that it has changed. The posterior radius of curvature has changed, and the vision has changed. And I know that there is a change in the way that this knows that this is progressor, and this is something which is important. And coming to the second point of it is the epithelial mapping. How does it help in my practice? Dan Reinstein has been talking about it, about the role of epithelium and how it makes an impact, and how the changes in the Bowman's layer. There are a lot of new things which are coming up now. Like I'm just picking up some important points from different topographies. This is important thing from a topographer OCT and topographer called MS39. It gives you this red on red points, and any points, if it's in the red circle, it means there is a definite chance of KC. If it's outside, it means you're safer. So the indices of topographies have moved out from just a bad D or a pentacam base. Now all the topographers are becoming very smart. For example, if you look at these kind of maps, if you look at this and you don't know whether this is an FFKC because it doesn't match with this, nor your posterior, nor your Paki, sometimes you get worried, what are you seeing? And now the machines have even looking at just a stromal elevation. And this is again from an MS39. That means that this area, if it's steeper, how is your stroma? That means, and what is the real? And this is not coinciding with your posterior. And if you really look at the epithelial mapping, it's an epithelium which is the culprit. So now the machines are moving out just from a pure Placido or a pure Scheinflug to a hybrid ones. It's combination of many things. And for example, look at this. This is a patient who has progression here from the first visit and a classical progression, but you can see in the second visit, the epithelium has become very thick. So what is happening is because the epithelium has become thick, it is actually showing like a progression. If I had only the pentacam without an epithelial mapping, then I would probably look at this as a progressor and I would probably do a cross-linking. Here, actually it's getting better because thinner epithelium is covered well, and you probably would, it's just a cause of hypertrophy for whatever reasons. We use sometimes drugs, cyclosporin. This could be a reactionary one, which is looking like it, like a change. But when you look at the stroma, it's absolutely normal. So there is no state, no progression at all. So what is important here is because there's no change in the stroma, we know this is not a keratoconus which is progressing. These are all the new changes which is going to come. A lot of happening in the biomechanics domain. We all spoken about the combination of a Corvus with the biomechanics. And this is the paper which talks about how you combine the topography with the biomechanical indices. But what is important here is this, which is very important because your stress and strain is measured by Young's modulus, and this measures the Young's modulus. That means that anything more than 1 is good, anything less than 1, like this, is weaker. So these are all new things which are coming up, and this, you can see that there's a stronger eye out here, and this really helps to understand what is happening to the keratoconus. And if you add the topography, the posterior elevation, the epithelial map, and the indices, you probably get a different picture. There are a lot of new tools like PSOCT, polarization sensitive OCT, which looks at how the collagen is, and you can see that different corneas have different type of collagen. This is completely normal. You can see how the orientation is, and here you see the complete loss of collagen out here. These are all the new features of it, and this tells you how after cross-linking, how it is getting better. And this also tells you that biomechanics tells you stiffer. I'm giving you a complete range of new things which is coming up, which is completely going to change the way we look at the process. This is a one single slide about how molecular factors are going to be useful. If not for COVID, I would have shown you the real demo of this, but now the whole world is focusing on COVID testing. So this is the prototype I have at this point of time, which will tell you all the molecular features which can make the patient go into a progression. So this is my last slide. How do you bring it to the clinic? It's not going to be too far away. We only started with pentacam. Now we are looking at imaging the collagen. All the OCTs in future will incorporate it. And now most of them will start bringing all the tier molecular factors into clinic. I'm sure it's going to get a little delayed with COVID, but eventually it will come. And modern day diagnostics like MS39 from CSO is going to be the future of how it's going to merge a lot of things in one topography. Thank you.
Thank you. Thank you very much.